I'm very excited here in Hollywood today, chatting to world-renowned cosmetic surgeon, Dr. David Matlock. He is a pioneer in laser vaginal rejuvenation and a world-leading expert in aesthetic body contouring. With a large celebrity clientele, I'm very happy to chat to Dr. David Matlock. Dr. David Matlock, welcome to the Face podcast.
Thank you.
You are a world-renowned cosmetic surgeon and a leading pioneer in vaginal rejuvenation and aesthetic body contouring. It's lovely to have this chat with you today.
Thank you very much.
We've seen a lot in the media about the recent increase in the usage of weight loss drugs. I have seen in my own practice, weight loss in the face is causing an increase in customers. Can you talk about what effects this is having on the body?
I would say, well, these GLP-1 agonists, these weight loss drugs, we're seeing a big, huge effect actually in the practice and on patients. Primarily the problem, I would say, and especially some of these entertainers, they really don't need it. They don't need it, but they're using it, and it's a drug, and they are not getting off of it. And as a result of that, they're seeing sagging of the skin. They're a huge weight loss. They're not getting off. They see a sagging of the skin, even of the face, of the body, of the buttocks as well. So that's the issues that we're seeing, and those are the things that they're coming in for us to address. I think we have to look at it. We have to address it because it's here, it's reality, and we have to deal with it as surgeons and as cosmetic dermatologists and so forth.
So they're having a rapid weight loss in a very short amount of time, and it's causing skin laxity. What sort of treatments are available to help with this?
Well, what the patients are coming in for is that they want the skin, the relaxation of the skin, the falling of the skin, okay? And I think really, they just need to get off of it and stop. We have a program where we can use it, okay, in our overall program. But so they're coming in, I want skin tightening. And the majority of them, they don't need to have skin resection, and they don't want the skin resection. They want to have non-surgical treatments for this. So you can have it in office or in the surgical center as well. So a lot of them are coming in and say, hey, you know what, with these products or with these medications, I have this overall weight loss, but I got sagging of this, that, and the other, of the butt, of the arms, and they're going like this with the arms of that. So they want treatments for that, and that so we can use what we call our tri-modality skin tightening, where we're using the Vaser. That's going to, each one of the modalities will give us some skin tightening. So the Vaser will give us some skin tightening, but it also augments and helps us to use the Renuvion. So in that Renuvion, we're using that for what we call the phytoreceptor network to tighten that internally, and we use Morpheus8 body to tighten externally. We're giving them what we feel is the maximum results for that skin tightening of what they need.
So a patient has been on a weight loss drug. They've lost an enormous amount of weight in a short amount of time. You have a tri-modality approach. So this includes Vaser, and then Renuvion,
Correct.
and then Morpheus8 body.
Correct.
Can you talk us through those 3 steps?
Okay, all right. The 3 steps are, and when you say a rapid weight loss, yeah, that's true, all right? But what I see, and especially on some of these celebrities, first of all, they don't need to be on it, but they're on it, okay? And then they don't know when to stop, and they stay on it. That's the problem, okay? So when we use the Vaser, that's older technology, and it's a ultrasonic technology, and so that's really going into the fat, and ultimately what it's doing is kind of dispersing it, all right? If we look at cosmetic surgery, if we look at liposuction, if we look at the hardest physically demanding cosmetic surgical procedure, it is the liposuction. So this does make it easy or easier for the surgeon, and where the surgeon can focus on sculpting the body. All right. So that's that. All right. Then we have the Renuvion, or the J-plasma Renuvion. And what that's doing is basically, if you look at the skin and we have the skin, you say, what's holding the skin? We call it this phytoreceptor network, FSN. So basically, if you look at the skin, if you look at some strings to the skin, okay, those fibers, that string, and then that's attached to the fascia, or the covering of the muscle. So those strings are elongating, all right, and it's sagging. So So in that Renuvion, when it fires, it looks like lightning, and it's hitting that fiber and it's shortening the fiber length and pulling on the skin. Also, what it's doing is inducing the body to generate those real youthful molecules, are that collagen and elastin and hyaluronics, okay, over time. So you got a dual effect with an immediate effect, and then over time of generating the hyaluronics and the elastin and so forth, and the collagen and all that, all those things that you see in youthful skin.
Yeah.
And then what we have to do is go externally as well with the Morpheus 8 body, which we can still get down to the fibroceptal network, but also it's really working on the skin to tighten and contract the skin. So that tri-modality, we're giving the patient the best.
So just to take me back, the Renuvion, which is J plasma, you're using a surgical instrument to, in effect, shrink the internal skin to tighten.
Correct.
And then you're coming back with the Morpheus 8 body to work on the external skin with the radio frequency and the needling.
Correct.
To tighten the outside of the skin.
Correct.
So this 3-step approach would be a good avenue to investigate for someone that has looser skin post-weight loss.
Correct. And then in surgery, since 98% of the patients want to be asleep, then we can use for the Morpheus a maximum. So you look at Morpheus that we're doing on the face in the clinic, well, 3 times, because we really can't crank that energy up. But in surgery, we can, so it's one and done.
Can you talk me through a patient, they have had a consultation with you, they're going to go ahead with this 3-part modality for skin tightening. They come into the office. What's that procedure look like?
Basically, they're having a consult, they're having a consult, and they can have a virtual consult. The virtual consult, because 46% of our patients are out of state and out of the country. We also get patients from...
I know.
Oh, yes.
I know you do. That's how I found out about you.
All right,
one of my patients
right.
has visited this very office.
All right. So they come in, they have the consult and everything. We want to be very meticulous in that consult to see exactly what the patient wants, what the patient needs, and make sure that we can deliver on what that patient wants. So they have that. That's all done and so forth, and consents and so forth and everything. Then they go for a surgery, they come in for surgery, and we have a beautiful surgical center right next door, 5,000 square feet, 3 operating rooms, 6 bed recovery, 3 pre-op rooms, Medicare certified. So then they have their surgical procedure. And again, 98% of patients want to have general anesthesia. So then they go through that. They have the procedure. After the procedure, they're in the recovery room about 2 hours, hour and a half to 2 hours, and then released to the custody of an adult to go home, and we'll see them in 4 days.
Okay.
All right. And then after that, we will see them in 3 weeks, and then after that, another 3 weeks. So that's 6 weeks, and then they're released from care. And so, and a lot of patients, again, the system works for those patients who are out of state. They have to be here 4 days.
Sure.
And then they can go. Everything is great and fine. We will see them virtually in 3 weeks. And 3 weeks from that, we send them their pictures and so forth. And we look at that side by side, before and after. Now, this is so big that the patients right here in LA, they say, oh, I want to be treated like I'm out of state. So they're around the corner, but we're doing a Zoom or a virtual consultation with them for their follow-up.
So you've had skin tightening. When can you return to exercise?
You can return to exercise in 2 weeks.
Sure.
Yeah, get up and go. We want you to get up and go. It's not something, we do not want you there in bed, laying down. We want you up and about. Is very, very important for your entire recovery procedure process.
Getting back to aesthetic body contouring surgery, there's a lot of misconception about what a BBL is. Can you tell us what a BBL is, Dr. Matlock?
So a BBL or a Brazilian butt lift, what that is basically what you're doing is that you're taking fat from other areas of the body, primarily the abdomen, the waist, the back, the arms, sometimes the thighs, outer thighs, inner thighs, even front of the thighs. So we're doing that, getting the fat, we're processing the fat. In our technique, 96% of that fat is alive. And we process it, we wash it with a double antibiotic solution, concentrate it, take what we call the tumescent solution out, concentrate is pure concentrated fat, 96% of the fat is alive. And then what we're doing is that we're going to inject that. But prior to the procedure, in the recovery room, I do a process where the patient tightens the butt so I can outline the butt, and then I divide the butt into 3 sections, top, middle, and bottom.
Sure.
And then, so I strategically look at what the patient needs, okay, and then based upon what the patient wants. And then in surgery, we are injecting it. It's just a small little incision, about a 1/4 of an inch, okay, 1/4 of an inch, all right. And then it's right up under the cheek. And we have a long cannula that we're going deep, middle, and superficial, laying that fat down, contouring that butt. So it may be top, middle, bottom, and maybe we're maybe just focusing on the outer part or the outer half of the butt, but we know exactly what the patient wants and exactly what the patient needs. And it really depends upon also how much fat she has and what we can do. Some patients say that they want the hip dips done as well.
Sure.
But we got to say that little dip in the side.
Yes.
They said, I don't like that. Okay, we can go ahead and fill that as well at the same time.
Is the hip dips an age thing?
No, the hip dips don't have to be an age thing. It's just that's your body.
Yes. So
Period.
with the media being the way it is, often a BBL, is presented, almost too overdone or like a cartoon. So people could be quite put off by that look. You have coined the term corporate booty. Can you explain to us what that is?
Yeah, a corporate butt is a registered trademark with the United States Patent and Trademark Office. And so I really saw a trend, all right? I'm on that cusp looking at that, seeing a trend. And I see women coming in and they don't want that big butt. They don't want that gigantic butt and the thighs and so forth. They don't want it. So a lot of patients are coming in because I don't want this anymore, all right? And so we're actually reducing it. We're sculpturing the butt. And it's just you're not going to have a flat butt. You still want the butt curved.
Sure.
We want the butt like a C, okay? But we will sculpture down the butt as needed based upon what the patient wants. How much do you want out? Do you want 30% out, 50% out, something like that? So we're working with the patient to give the patient exactly what she wants. That's what we're seeing, and that's why we say we have our corporate butt. A woman came into me and she said, you know what, doctor, I don't want this. Bam! I want, that's nice. That's how we came up with our corporate butt.
So for age ranges for something like, from a BBL to a corporate butt, are the younger girls wanting something a little fuller? Is it an older age group looking for the corporate butt? What are you finding?
I would say you can see a full spectrum. And you see a lot of the young women, they have that. All right, that big butt, which they don't want anymore. All right, corporate, that doesn't go well in the corporate boardroom.
It doesn't.
The corporate butt goes well in the corporate boardroom or in a work sitting overall. So they may have done this in a younger age or something like that, and they want it changed. Okay, and that's the trend. That's what's happening. And also I would say too, that we can see that social media is driving a heck of a lot of this, okay? A lot of it. And those celebrities are driving it as well.
Speaking of celebrities, you have a very famous client who's been very open with her journey of plastic surgery, having her fillers dissolved at some point, which was Blac Chyna. Now, she was known for her curves. And what happened with her, she had some silicone injections to her butt. Can you talk us through that?
Yeah, so what she wanted, basically, I've known her maybe 10 years, 12 years or something like that. And so what she wanted, she didn't want that anymore. She just didn't want it anymore, and she was having some irregularities. There was some irregularities, all right? And then some firm areas and hard areas, and she really wanted brought down. I had patients, well, what did Blac Chyna do? How much did she have out? I said, well, she had 50% out. All right, so that's what we did and worked as hard as possible to remove as much as of that illegal filler.
Sorry to interrupt you there, but illegal filler, so silicone is not a legal substance to inject in America. It's not in Australia. So she had the procedure done with a filler that's not meant to be used.
Right.
And it caused some irregularity in symmetry for her?
Right. It caused irregularity in symmetry and just too big.
Okay.
It's just too big. She didn't want that anymore. She didn't want that for her look anymore. You know, she really wanted to bring the butt down and remove that filler, you know, that illegal silicone. She wanted that removed. And, you know, I tell patients, please don't do that. We see so many horror stories. We have to deal with patients from around the world with these, that illegal filler, that silicone in the buttocks, all right? And it's a mess. Women really hate that they did it, and they really regret that they did it. So our message to women out there, just don't do it. You don't understand the risk. You know, there's a risk of death. These people are lay people, meaning that they're just Joe Blow off the street.
So they're not registered medical professionals?
They're not registered medical professionals at all, period.
So Blac Chyna wanted a more finer look, a slimmer look. So she had you remove that silicone.
I removed the silicone from the butt. It's just a small little bitty incision right up under the cheek to go ahead and do it. You know, if you look at some of the socials and things that we do on this, because we do it so much,
sure,
you'll see that, you know, we call it these pearls that would block up the cannula. You know, we have to change cannulas and so forth to be able to remove all of this product, you know. So, I mean, she's very, very happy. She looks absolutely 100% fantastic, and she's happy. So, and I think that it's very noble of her to talk about it and
Agreed.
to talk about the problems and the dangers with this. You know, we want to be advocates for women. We please just don't do it.
She looks so much younger too.
Yeah, she looks younger.
Beautiful.
Yeah.
So well done.
Right.
So we're going to stay below the belt here. We've spoken about posterior. Now can we talk about anterior, which is your specialty, vaginal rejuvenation?
Vaginal rejuvenation, I mean, primarily if we're looking at vaginal rejuvenation or laser vaginal rejuvenation, women are coming in, and it's primarily women who have had children.
Sure.
And, you know, things change, the body changes. So what I looked at early on, I'm saying I am an advocate for the women. I was asked by the media, are you a feminist? I said, yeah, I'm a feminist, okay? So what I found was that the doctors would just say, oh, just do Kegels. You know, Kegels don't work, or just accept it. It's a normal part of aging. But, you know, that's not right. All right. I mean, if this was a male issue, it would have been looked at and solved a long time ago.
Sure.
Okay. So what I did, I mean, I looked at it. And being in cosmetic surgery, what I wanted to do is that I wanted to concern myself with form, function, and appearance.
Sure.
You know, so women basically, it's just a woman with a child, she wants to reverse things. What is all cosmetic surgery about? It's all about usefulness, okay? And let's be honest, a woman having a baby is it's destructive to the birth canal. And the more children, the more destruction that you have. Even if you had a C-section, well, at a point, the damage has been done. Oh, I pushed for 24 hours and so forth. Baby wouldn't come out. I had to have a C-section. Well, the damage is done.
Sure.
So what I looked at, again, form, function, appearance, I said, let me restore the woman, okay? I understand the surgeries that are done there, but let me restore the woman. So I came up with this whole thing, and I brought in other cosmetic surgical procedures and techniques and focused on aesthetics, focused on function, form, function, and appearance. So in my laser vaginal rejuvenation, basically the muscles should be nice, tight, and together. Okay, if you look at the muscles, right side of the body and left side of the body. So basically those muscles are pulled apart. If we look at the top of the vagina, well, the bladder can fall, the urethra can fall. And as a result of that, women can have a problem with stress urinary incontinence. If they laugh, cough, strain, and exercise, they can lose urine, all right? So that's socially embarrassing and hygienically unacceptable to women. So some say Kegels. We hear Kegels. Kegels don't work.
They don't.
Okay, period. I've heard it time and time and again, but the doctor will say, just go do Kegels.
Sure.
They don't work. It's only for 10% of women, okay, less than 10% with mild a condition like that. So laser vaginal rejuvenation stops all of that, and it supports everything at the top. All right, of the vagina, bottom of the vagina. It decreases the internal diameter, and it builds up the perineal body, the area immediately outside the vagina, and it makes things pretty on the outside as well. Pretty meaning that women don't want the introitus gaping apart. They want it more slit-like, okay? They want it closed. They want the labia minora, the small lips, coming back together in the midline. They want the large lips, the labia majora, coming back together in the midline and build up the perineal body. Women also want to enhance sexual gratification. We have all the scientific papers. I'm a co-author of a book on this subject as well, and it has shown that it enhances sexual gratification. All right, if I decrease the internal diameter, external diameter, build up the perineal body, I can enhance sexual gratification also. So that's a byproduct of it. Women want all of that, okay, and they deserve that. And so with this laser vaginal rejuvenation, we can. If the woman says, I want to be like 20, 18, whatever, we can do that. Okay.
So when they're coming in, these women, what's the number one thing they're saying to you? Is it the appearance or is it the function?
It's the function.
Oh.
Number one, they want to be tighter.
Okay.
They want to enhance sexual gratification. Number one. Okay.
I hear it a lot in menopausal women, such complaints as incontinence. So does the laser vaginal rejuvenation improve that also?
Yeah, it will stop the incontinence. Okay, it will stop the incontinence. All right. It'll stop the incontinence.
Sure.
It's a little different situation because for that woman who is postmenopausal, we got to consider what's happening, what's going on. Oh yeah, she still has that relaxation. Oh, is she going to go on hormones? And so every case is different. And so we have to approach it differently as well.
In terms of a surgical procedure, which is labiaplasty, how does the laser rejuvenation compare?
Labiaplasty, so we got to look at external. If you look at this whole laser vaginal rejuvenation or designer laser vaginoplasty, we've got to look at internal, you got to look external. So if that woman wants to say, hey, my labia minora are too large, okay, they're entrapped with sexual intercourse or with clothing, all right, I have this camel toe, I look too big there.
Sure.
My labia, I'm riding the bike or I'm a horse trainer and it's uncomfortable. So, okay, we can sculpt the labia down.
Yeah, wow.
Okay, so that's what they want. But I would say the majority of that, it's all about aesthetics. It's all about aesthetics. Is it functional? Nah, some people have that. Like I said, the horse trainers and so forth, the cyclists, and we have triathletes and so forth. But I would think that it's more aesthetics.
It definitely would be.
Want.
Yes, that's really interesting. My patients are aging with me and, we all look to Hollywood. We're here in the epicenter. What are these celebrities getting done?
I think, the celebrities are getting things done. They're looking to more minimally invasive things, okay? They're looking at things like this Morpheus and all these non-surgical or these microneedling radio frequency type things. They are looking at the fillers as well, on the lips and the cheeks, as long as they're not doing it too much, all right? So all those things where they can maintain that youth, that's what they're looking at. Based upon the age, some are looking at more surgical things of the face and everything. Especially another big thing that they're doing is all the neurotoxins. They want all of that. So, a lot of this in that industry, it's about the face and so forth and body and all that. So those are things that they're looking at. The minimally invasive things, where there's not a lot of downtime at all. So all of those things they're looking at, minimally invasive, face. All right. The other things that they are looking at is the body, and really like some patients they would come in and they would have to gain weight. I think it's bad, honestly, but they're doing it for a role to gain that weight. And then afterwards, they have to lose it. And so they're coming in for the liposuction. Some of them may come in it's really role driven. It's role driven. And also it is maintaining that youthfulness, okay, that they have to do. So it may be body things. It may be things from relaxed skin. It may be some of the men. They want the six-pack. They need the six-pack for this role. And like I said, a lot of times the trainers are sending them in. So in my situation of having these celebrities, and how do you do it? How does it happen? You're in this clique, and they know. That's how it all comes about. So you're there to provide what you can provide for them, for them to help to maintain or achieve what they need to achieve at that particular point.
It's a lot of pressure.
It's a lot of pressure, and some of them are coming in, they're coming in for a new role or whatever and so forth. They got to get in shape. We had a phase here that we went through where we didn't understand why the trainer was sending that celebrity in.
Yeah, wow.
Okay? The trainer was doing that. Well, the trainer wanted that huge jump start, and then he'll finish up.
Wow.
Okay, so that was a very interesting phase that we went through, that the trainer is pushing that.
But they're only going to credit the trainer, though.
They only will credit the trainer.
There's a lot more going on behind the scenes.
Yeah.
So we're in 2024. What trends do you see are shifting in the celebrity culture here in Hollywood?
Well, number one, they need to get off those drugs. They need to get off of those, because when I say that, as far as those weight loss drugs, what we have seen, again, is patients that don't need to be on it. They're on it. I say it's a drug. They're addicted to it. They stay on it. Then they have an issue with skin and so forth and everything, and droopy skin or a droopy butt or face. And then, now they need treatment, to help to reverse those things or stop those things. If they would have got off it from the beginning. So I say how to use that, and we can just go back to it a minute, is that, you know what? Okay, all right, fine. How much do you want to lose? Okay, but before engaging in that medication, let's look at your diet, let's look at your exercise to maintain it. Go ahead and start it. You reach that goal, then stop it. And then maintain with your diet and exercise.
But they're losing so much weight, it does become an addiction almost.
That's right. Absolutely.
But then a whole another set of problems, which is the droopiness of all of the skin on the body and face.
Right. And it didn't need to be.
Is the droopiness of the skin happening because the weight loss is so rapid?
I would say it's rapid, but then they're continuing to hurt themselves and their bodies.
So if they then come in for, say, a skin tightening treatment with you, but then stay on the weight loss drug, will they need more treatment with you?
They need more treatment, and they can come to the point they're beyond treatment.
Yeah. Do you think there's been a massive increase in the skin tightening for the body?
So again, we use our tri-modality skin tightening to give the patient the ultimate amount of skin tightening possible. But that's a big thing too, especially of the arms, of the body, of the waist, of the abdomen. So they want all those things, and a lot of times they're having that in combination with the liposuction.
Let's just talk about Renuvion and J-plasma for a moment. If a patient wasn't wanting to go down the facelift route, would Renuvion be suitable for the jawline?
Okay, well, I don't use Renuvion for that area.
Okay.
I may use the Vaser, I may out Morpheus 8, face. I'll go ahead and do that. But I think people have to be realistic too. Like say, I want skin tightening of the abdomen. Well, you know what? If you need a tummy tuck, you need a tummy tuck. And those modalities aren't going to do it. So I think it's important for the doctor to be able to tell the patient how this technology can and cannot work. That's the important thing.
Trends change a lot, Dr. Matlock. So what are you kind of seeing has been the shift?
Patients and celebrities are coming in now, and basically what they want something more natural, all right? Something more natural, especially say with the corporate butt. They want that, all right? They don't want that big butt anymore or the big thighs or anything like that. They want a more sculptured body. They want a more athletic body. And in those women where you would say our Vaser high def or VHD procedures where they would want the abs, the women don't come in for that. They want a softer look. All right. They want, we see that outline for them to be in the bikini and so forth. So they want that. Mostly before it was something for the men, but now the women want it. They want the arms. They want to see that sculptured look. They want to see that deltoid triceps. Okay, biceps. Yeah. They want to see that. They want those procedures. All right. They want to see the the tightness of the thighs and so forth, their inner thighs or outer thighs. So that's what they're looking for. We also see that they're coming in and they want to have multiple procedures. They may want to have the breast lift and so forth and things like that. And along with those procedures, those who may need a tummy tuck, they're coming in, I want everything and all of that at one sitting. What we can do, we may have to bring in multiple surgeons or 2 surgeons and everything to be able to accomplish what that patient wants. So those are the things that we're seeing, especially for bodies. Some of them are coming in, hey, I want laser vaginal rejuvenation along with these. I want laser vaginal rejuvenation. I want a corporate butt. I want a tummy tuck. All of this in combination. That's what we're seeing.
About 5 years ago, when I was visiting LA and I'd go out at night, I would see some of these fitness models and their abs were so defined. All of the girls kind of had that same look. I felt that the look was a little bit obvious, that they'd had a surgical intervention. So what you're saying is it's sort of evolved from that now to a more natural, more undetectable look?
More undetectable look or more of a softer look.
Sure.
Okay?
Yeah.
A softer look, especially when you're dealing with the abs and you're doing those kind of things, a softer look. But then again, we have some patients with that hard look. Females that want that hard look, but that's a minority of patients, and they can pull it off and carry it.
Are a lot of the models and actresses having treatments in Hollywood?
I would say yes. I would say yes. And I would say that, and again, you have to understand them. That's their business to look good, their bodies and everything. That's their business. So we can understand that. If you say, well, here's a new role and everything, they're coming in. Yeah, okay, fine. We can see that, but that's their business. And I think you have to understand it. And as long as they're realistic.
Why do you think there's still a certain amount of, a person being quite discreet about this kind of treatment? Why? I love the fact that Blac Chyna was so open with her journey. Why is there still a certain embarrassment around wanting to look better?
Well, I think that I go to a lot of events.
Sure.
Okay? I go to a lot of events. I see some of the celebrities. Dr. Matlock.
Yeah, of course.
They don't know you.
Well, even for me, I'm a non-surgical provider, and at different parties, people don't talk to me because someone might assume that I am treating them.
I know. But I'm talking about patients that I have or celebrities that I have.
Yeah, absolutely.
Okay.
They pretend they don't know you.
Yeah, pretend you don't know you.
Sure.
I can understand that. I'm fine with that.
But the consumer loves when a celebrity is open about what they've had done because it gives them an insight and education into the possibilities. But do you think it's a fear of being judged?
Well, I don't know if it's a fear of being judged. They want to say, it's me.
Sure.
It's all me, 100% me. If you know the people that I've done, you'll fall on the floor. But it's all me.
Can you please tell us?
I can't tell you.
Yeah, I understand that, but there's still so much judgment from society about having surgical procedures.
Yeah, I think those patients, treated Academy Award winners, Grammy winners, American Music Award winners, all of that, billionaires, okay? But you're the plague.
Sure, and they're not open about it
They're
at all.
not open about it at all.
Yeah, it's a very personal decision.
Yeah.
For sure.
And I can see that, and I can understand that, and they have an image to uphold, and, that's it.
You are at the forefront of a rapidly changing technology. I mean, Renuvion, for example, in terms of skin tightening, is so new and wonderful. What's getting you excited about your work?
What's making me excited about
Yeah.
on everything I do. I love what I do, and I love helping people, all right? And so I enjoy what I do, but I really love helping people and having those patients that they're happy and that I've helped them to achieve their goals. That's satisfying to me.
With social media, it's been wonderful in so many ways, but it's also been a minefield for the consumer about who is properly qualified. Before and after photos can be obviously photoshopped, etc. What would be your advice to a patient looking to have or be led down the right pathway to making a decision like surgery?
Yeah, I would say I get patients all the time that come in and they're showing me pictures on social media. Can I look like her? I said, listen, I want them to really 100% understand. And I know these celebrities and talk to these celebrities, okay? And every single thing is Photoshopped. Every single thing is Facetune, Photoshop, and so forth. So they have to understand that. They can't think that that picture on social media, that's them, because it's not.
No.
All right. So that's the thing. They come all the time. Can I show you a picture? Yeah. Can I get this? I said, no, I'll tell patients, no, you can't get this because that's not your body type.
No.
It's not your body type. This is this person's body type. And this has been altered. You can't get it. So the majority of times I'm telling them, no, you can't. Okay. And to say, hey, and a lot of it is, I can't compete against artificial alteration. And I hate to see what's coming with AI.
It's getting completely unrealistic. I mean, I love those celebrity Instagram pages that show the photoshopped version and then the real version. And we have pores in our skin. The photoshopped photos, the skin is so smooth. No one looks like that in real life. So are we becoming too unrealistic?
Yeah, well, it may be unrealistic, but you got to bring them back down to reality.
Yeah.
And I do. And if they're not, I won't do the surgery.
How many people do you turn away?
I would say, we turn away a fair share of patients, and especially if they're unrealistic, all right? And I'm thinking of one particular patient who was completely unrealistic, and I said, I'm not going to do it. And I wrote, here's why. I said, I'm just not going to do it. Oh, come on. I said, I'm not going to do it. And the patient came back. I got it. I'm fine. I understand. Okay, let's do it. Okay, fine.
Yeah. So in terms of a patient coming to you with an issue or a complication, not unlike what Blac Chyna came to you, are you always in a position to help?
Yeah, well, you're not always in a position to help, but as long as you get that patient to be realistic, you say, you know what, just say someone had an illegal filler and it's like a baseball, okay, a golf ball. I can't get that out with suctioning. You may have to be cut to take that out. So to understand, a lot of times we see that filler is in the upper third and they want the butt brought down. So I can remove some of that, but at least get the fat and bring the butt down so it's not so gigantic. So again, everyone's different, everyone's unique, and we just try to do what we can do to help that patient.
What's next for you?
What's next for me and what I have done, I just rebranded the practice because of the fact that patients ask for these things.
Sure.
They say, hey, I want this, I want this, I want this. I want the non-surgical things, which I've never done. All right, now, okay, all right, fine. Here's the non-surgical things in the office that we're bringing in. We're bringing a nurse practitioner and so forth to do all the fillers and the neurotoxins and so forth. So basically in the past, they wanted, okay, all right, fine, I'll do it. But now here's a bona fide program that we have with our Aesthetic Surgery Institute and Med Spa. We brought in, because a lot of things I would refer out, the patients prefer to have everything under one roof. So I brought in practitioners like Dr. Andrew Orden, who's on the doctors and so forth, So brought in all these doctors to be able to provide all these other procedures that the patients want under one roof. So, I mean, that's the biggest thing for me, I would say.
If a patient was hoping to have treatment with you, in the lead up to that treatment, what would be the best advice?
In the lead up to that treatment, I would say I would ask the patient to go on the website, read as much as you can read, okay? Read as much as you can read, get a consult with us, have a consult. You can be anywhere in the world, and we can do a FaceTime, we can do a Zoom, or we have our internal mechanisms to go ahead through our electronic medical record system to do a confidential consult. We may have the patient to send pictures and so forth, but we can do all that. And the vast majority of everything can be done just with that. The patient can see exactly what they need and then come in and be all ready for surgery. Okay. So that's it.
And in terms of their health and wellness, do you encourage diet and exercise? It's an important factor.
We 100% encourage diet and exercise, and that's all a part of that. And we will deal with that and talk about that, and I believe in that. And we'll show you a picture of me. All right. But my whole thing is it's about health. It's about health, and it's looking at things. No red meat, no pork, high protein, low carb, low fat diet, low cholesterol diet. Over 33, 35 years, that's how I've lived.
Sure.
And I think the other thing that you want to do is to decrease stress. I think of all those things, stress is the hardest.
100%.
So I think women need to stop all of this cardio,
I agree.
Okay, and get into weight training. As we
100%.
age, we want to go ahead and use resistance training, okay, to maintain the body. All right. I mean, that's very, very important. And I think that they need to kind of look at this and switch, okay, and not just be that, my wife says, that cardio queen. They need to get into weight training. They're going to age much better, and they're going to have a nicer toned body. So that's what I see.
I found that too, like going into perimenopause, that I had to stop all the excessive cardio because my cortisol levels were going through the roof. And since adopting Pilates and weight training, I started to look better as well.
Absolutely. Absolutely.
So I'm so happy that we had this chat today, Dr. Matlock. Thank you so much for letting me come and see you here and record the Face podcast.
My pleasure. Thank you very much.